Patient assessment trauma, Jess. You're dispatched to the Kellogg City pool. Somebody dove in the shallow end
Okay.
and is now unresponsive.
All right. BSI, is my scene safe?
Yeah, you arrive on scene. The lifeguards do not have him sea-collared, but they're extricating him from the pool on a backboard.
Okay. All right. So, mechanism of injury would be a potential injury from a dive into the pool. I'm going to say, is this my only patient?
Yes.
I'm going to request for additional EMS, and I'm going to definitely consider C-spine for this patient. So then I'm going to approach the patient, so they're in the pool. Do I notice anything there?
He's out of the pool now on the backboard, laying on the deck. He is unresponsive. He's unresponsive.
Unresponsive? Okay. Yeah. All right, so my general impression of this patient is poor. He's unresponsive. Definitely possible injury. I'm going to go ahead and assess for any major bleeding. Do I notice anything there?
No.
Okay. So at this time, I'm going to go ahead and start my ABCs. Airway, is the airway open?
You notice that he has some water in there.
Water, okay.
Yeah.
I'm going to go have my partner suction that.
Okay.
And maintain the airway. And then once he's done suctioning, probably put in an oral adjunct.
Okay. He accepts the oral adjunct.
Okay. Breathing. How's my patient's breathing?
He's breathing 8 times a minute, shallow.
Okay. After suctioning and airway, I'm going to have my partner back valve mask this patient and give some assistance to ventilations. And I'm going to check for my patient's skin color, temperature, condition. What do I notice?
You notice that he has a line of demarcation just at the nipple line where skin color is pink, warm, and dry on the top, and then pale and cold below.
Okay. Is my patient C-colored at this time?
Is he C-colored at this time?
Well, if he's not, I'm going to have him C-colored.
He's C-colored at this time.
Okay. And fully immobilized.
Okay.
To treat for possible neck injury.
Okay.
So this is a high priority transport. We're going to get them loaded and going. I'm going to have my partner get a sample history and OPQRST, and I'm going to start in on my secondary assessment. So I'm going to start with the head.
Okay.
All right, do I notice any decap BTLS?
He has like a scrape from hitting the bottom of the pool on his forehead.
Okay, a little scrape. All right.
Scrape.
I'm going to check pupils and check for any battle signs on the eyes.
No.
Okay, any fluid coming from the ears?
No.
Okay, checking for the patient's cervical spine. Do I notice any step-offs or anything?
You notice one step off.
Okay, all right. Moving on to airway. Do I notice anything in the airway?
No.
Is it still
patent.
Still patent.
He's still accepting your OPA that you've placed.
Okay. Checking for tracheal deviation and JVD.
No JVD, no tracheal deviation.
Okay. Palpating the chest. Do I notice any flail segments or anything?
Nope, clear.
Okay. I'm going to auscultate. How's my lung sounds?
Equal bilateral.
Okay. Moving on to abdomen. I'm going to palpate, feeling for distension or any rigidity.
Clear.
Okay. Palpating the pelvis, pushing in and down. Do I notice any instability or any tenderness or anything?
No, you're clear.
Okay, checking priapism, checking lower extremities. Do I notice any decap BTLS on the lower extremities?
No, he's clear.
Okay.
And he has a pulse.
Pulse, okay. Checking upper extremities, same thing, looking for any decap BTLS, anything noticeable?
Nope, still has pulse.
Okay.
So your partner comes back with your vitals. Patient is mildly bradycardic at 55.
Okay.
Blood pressure is 50/20. He's artificially ventilated. GCS of 3.
Okay.
BGL of 100.
If I haven't said it already, I would treat for shock.
Okay.
High flow oxygen and a blanket to cover my patient. And I'm going to go ahead and get 2 large bore IVs, and I'm going to start treating for neurogenic shock. So I'm going to give Levofed with 8 micrograms per minute. So to do that, I'd give 4 milligrams into a 250 milliliter D5W bag, and then my goal would be 30 drops per minute. And then at that time, after I've done that, I'm going to reassess vitals. What do I have for vitals?
Blood pressure's come up. He's permissively hypertensive.
Okay.
He's still mildly bradycardic.
Okay. All right. So we're going to go ahead and rapid transport, checking vitals every 5 minutes, reassessing any interventions that I've done, making sure we've got BVM for assisting ventilations. I'll prepare to intubate the patient if for some reason we get a loss in respiratory drive or anything like that.
Okay.
And at this time, it was just rapid transport to the nearest trauma center, and I think I'm done with this patient.
Good job.